So in 2016, I was handed over the reins of our family arable farm in Cambridgeshire. This was also my 15th year as a medical doctor, where time and time again I've found myself offering an empty prescription. Eat more fruit and vegetables. Get out and enjoy nature and fresh air. But short of tools in the box to offer any solutions to the real and perceived problems people had. It occurred to me that farmers might be in a unique position to help their local communities achieve healthier lives. After all, we grow food, and food is medicine. We have space and nature. We have the potential to contribute to climate change mitigation and improve water and air quality. And we're experienced in diversifying and adapting our businesses. In the back of my mind, a Nuffield question was brewing. Health is a state of complete physical, mental, and social well-being. And there are many potential areas to focus on. Access to green spaces and nature, community to building enterprises, mental health opportunities, and tackling social isolation, to name a few. But perhaps the biggest barrier, the biggest elephant in the room is diet-related ill health and the huge burden this places on people's lives, the health service, and the country's economy. Estimated to cost UK society £98 billion per year, and poor diet is the leading cause of avoidable harm to our health. Fruit and veg, fibre, UPFs, put simply, we're short of the good stuff and eating too much of the bad stuff. Barriers to healthy eating include knowledge gaps around food, nutrition, and cooking. Also, social influences and lack of time, but top of the list is affordability and accessibility. Making healthy food the easy, cheaper, and accessible choice alongside tackling unhealthy food advertising is some of the key messaging coming out of food systems policy advice. This is a noisy space. Advocates, parliamentary working groups, and think tanks. Here's just a snapshot of some of the UK-based organisations working hard in this space to make change. And on the left, just a few of the books and reports published in just the last few years. Well, this was all information overload and fairly overwhelming. So I put the reading down, and I went to see some people and some cool stuff. I travelled to countries in Europe and North America that have similar ag, food, and health challenges. This scholarship allowed me to meet some awesome farmers and growers, but it also led me to many other people working in this area, from teachers and chefs to public food procurers, wholesalers, and retailers, from charities and social enterprises to researchers, policymakers, and urban planners, nutritionists, doctors, social prescribers, to community leaders and youth workers. I visited inspirational examples of food and farming education, saw programs addressing financial barriers to local healthy food, discovered the food is medicine movement, appreciated the wider health implications and false economy of certain foods, learned about the health opportunities that public food procurement can deliver, witnessed working solutions to short food supply chains, and experienced the unique health opportunities that local food can bring to the table. 3 standout visits are going to highlight 3 key opportunities and messages for farmers, the wider ag, food, and healthcare sectors. The whole school approach to food education. The food is medicine movement, using food that supports multiple health improvements. And the universal language of food to deliver health through community. The municipal of Mouassattou in the south of France successfully combines a whole school approach to food education, connecting produce supply to school kitchens with immersive classes within the growing space and local community involvement. 3 full-time farmers employed as civil servants grow on a 6-hectare farm and supply 96% of the fruit and veg requirements, serving over 1,000 meals a day. Each class has dedicated weeks in the term where they learn in the farm classroom rather than at a usual school location, using the growing space and food as the overarching theme to all their different lessons. Kitchen staff have a central role in nurturing children's appreciation of food. This close contact between farmers, kitchen staff, teachers, and children has led to a remarkable 80% reduction in food waste, and they're achieving the shift to local sustainable food without any change in the budget. Offering nutritious food choices and building food confidence has provided the building blocks of a long-standing, healthy relationship with food. These children have become agents of change within their families and the wider community, with nearly 3/4 of the city's inhabitants improving their healthy eating habits. Perhaps there is an argument to coordinate the efforts of the many great organisations working in this space in the UK, designing a whole school approach that includes a local community of farmers, catering staff, teachers and families, with consistent messaging from both healthy food lessons and healthy school food, leveraging the potential of public food procurement and backing this up by better understanding the cost-saving public health outcomes this could achieve. This is Dr. Stephen Chen, Chief Medical Officer at Recipe for Health, a nationally recognized, award-winning food as medicine initiative in Alameda County, California. He uses food as a tool to treat and prevent diet-related chronic disease in food-insecure adults. He prescribes nutrition education along discounted fruit and veg. Data shows lower blood sugars, improved cholesterols, and decreased emergency room visits. These produce prescriptions are popular with patients and deliver cost-effective positive health outcomes. But what really stood out for me is that Dr. Chen recognized that the health of his patients can be affected, for better or worse, by how and where that food is produced. This might be via a direct impact on the patient, such as nutrient density, which we've just talked about, or pesticide residues, or via affecting wider drivers of health, like local economies and fair employment. Dr. Chen also recognizes that the climate crisis is a health crisis. Certain food systems contribute to worsening climate crisis, which lead to real adverse health outcomes for his patients, such as heat waves, forest fires, and vector-borne diseases. Dr. Chen bothered to ask the question, where does the food in my Food is Medicine program come from? And he teamed up with a local BIPOC-led Dig Deep Farms to supply organic regenerative food. Dr. Chen has the vision to build a program that he terms a health multiplier. This principle of procuring food with wider health and societal benefits is relevant to many settings, especially public food procurement into schools and hospitals, which could act as a lever to support this emerging market opportunity. Shelldale Park Farm in Guelph, Canada, operates on multiple levels within the community, including a unique and visibly successful opportunity for new immigrants arriving in the city. Their coordinator, Omonissa Giddam, organised a morning to introduce me to some of the group. What a privilege, sitting with over 20 people speaking 18 different languages. But it was clear that working alongside each other with a shared knowledge and appreciation of growing, cooking, and eating food helped both long-standing and new members of the community come together. At the medical centre across the parking lot in that picture, produce was offered to patients to try, giving an informal, no-questions-asked, free offering with advice on preparing and cooking. This was just one of many examples seen during my travels where common ground was found in talking about growing and sharing food, breaking down barriers and, in the healthcare setting, being the spark that leads to accessing much-needed healthcare and social services. We've been asked to farm for quantity, to alleviate hunger, with society blissfully unaware of the deep connections between food, climate, nature, and health. But now we have a growing understanding of what we didn't know, or in some cases might have forgotten through the generations. Climate, nature, and food systems are impacting our health, and this research and evidence is coming thick and fast. When I was at med school, no one talked about the gut microbiome or brain food or ultra-processed food. Blimey, 20 minutes ago, most of us didn't even know just how different the nutritional content of food could be. And this knowledge and evidence is trickling down to people who make decisions and the people who advise them. They're starting to recognize the huge and potentially avoidable societal costs of diet-related ill health. The climate crisis is a health crisis. Growing, procuring, and eating food with negative health impacts is a false economy. The whole school approach to food education is the foundation to building healthy relationships with food that society is craving. And growing, cooking, and sharing food is a powerful, universal language that can build communities and spark positive change. The question is, as UK farmers, are we ready to get involved and promote and supply these markets? Well, what can we do as farmers? Firstly, we can appreciate there is a role to play in supporting a healthy community. We can get involved in our local school food education. We can acknowledge and prepare for emerging markets that are looking for healthy food with wider health benefits. If we can't prove we can deliver this, the global supply will. We can get involved in the research, data collection, and transparency that can promote these markets. We can engage with local public food procurement. And seeing as we're going to be 4 million tons short of fruit and veg if everyone ate their 5 fruit and veg a day, perhaps we should make a small area of our farm available to a market gardener. So let us be proud that UK agriculture has a significant role to play in improving UK health, and position ourselves at the front and centre of designing, promoting, and supplying these opportunities and markets. So firstly, a huge thank you to my wife, Heather, for her continued unwavering support, making the space to let me get on with Nuffield. Thank you to all our awesome 23 scholars group, and thank you to the hard-working Nuffield Farming Scholarships Trust team and the NFU Mutual Charitable Trust for their generous sponsorship. And thank you finally to all the brilliant people who have given their time and hospitality, allowing me to experience and understand some of this enormously complicated and challenging subject, and hopefully inspire us to make better individual and industry-wide links between agriculture and health in the future. Thank you very much.